intermittent fasting, what is it? So it is really not so much about starving ourselves. It's really all about meal timings. So basically, you're still eating the same amount of calories, but it's more about when you're eating them, okay? It is a very popular health and fitness trend, and there's a lot of research, scientific research to back it up. In fact, some research shows that it may be one of the most powerful dietary interventions that we have today. So I didn't feel we could move forward with this discussion before mentioning just a bit about the history of fasting. The concept of fasting goes back to ancient times across all religions. It was and still is often done for cultural or religious reasons. But it was also recommended back then for health reasons. There were a lot of philosophers, even Hippocrates, who is the father of medicine, who talked about fasting periods to help heal from disease. So we now have a modern revival, basically, of this very ancient tradition and practice. Now, there are all kinds of fasts out there. Many of us have heard of these. These are just a few that you may have heard of or even have done in the past. These are often marketed with lots of promises of weight loss and increased energy and whatnot. But unfortunately, there's no real evidence that shows that these lead to any kind of weight loss or even better health. Keep in mind that these fasts are sometimes difficult to continue long term, and they're almost always short-lived without a whole lot of significant results. Now, before I jump into talking about intermittent fasting, let's just take a quick look at who should not be fasting, all right? Pregnant nursing women, they obviously need extra calories, and they have to eat more frequently as well. Children less than 18 years old, not recommended for, and anybody who has any major medical conditions, typically in the more advanced stages like liver or kidney disease. Many people with just general medical conditions like diabetes, heart disease, can still do this type of fasting, but I'll always recommend doing it under a physician supervision. Regardless, though, I think it's very important to let your physician know that you're interested in doing intermittent fasting just to be on the safe side. And then obviously anybody who has a history of anorexia, bulimia, I would not recommend intermittent fasting with. Anybody who's had recent surgery, or like I said before, any major illness, I would not recommend it. And anyone who's just afraid of fasting, it's not for everybody. You should not feel like you are forced into it. If you do it, I think it's important to approach it wholeheartedly. Like I said, it's not for everybody. So let's focus a little bit more now on intermittent fasting, all right? So remember, like I said earlier, it's not about starving oneself, okay? Rather, it's about changing the timings of our meals. It's about our eating pattern. And then just something else to think about. You never want to jump into doing intermittent fasting right away. You want to transition first into a low carbohydrate diet, and then you want to do intermittent fasting. If not, say for example, you're just eating a normal American diet, which tends to be high in processed carbs and bad fats. And then all of a sudden you decide that starting tomorrow you want to start fasting. And often it backfires because, one, you're going to be miserable not being able to eat. You're going to get hungry. And two, when you break your fast, you're going to crave carbs. And then that's going to cause you to overindulge, and then the entire intermittent fast will backfire. So I think if done correctly, this can be very successful. Whenever I have patients that I am starting on their weight loss program, I usually do not recommend starting intermittent fasting right away, because I want them to first get used to lowering their carbohydrates, lowering their sugars, and then we incorporate it in later if I think it's needed.